Have you ever reached the end of a long day, maybe after standing for hours at work or, you know, settling into your favorite chair for an afternoon, and your legs just feel heavy,
Uh-huh.
a little tired, maybe swollen around the ankles, or even kind of tingly?
Yeah, that feeling.
It's a feeling many of us experience,
Yeah,
like a minor inconvenience we often just brush off.
sure.
But for millions, especially as we navigate the later chapters of life here in the U.S., these sensations can be whispers of something much deeper at play.
Mm-hmm.
Today, we're taking a deep dive into a condition that truly impacts quality of life: chronic venous insufficiency, or CVI.
It's a big one.
Our mission on this deep dive is to move beyond those surface symptoms. We really want to understand this often misunderstood condition, its intricate causes, how it quietly progresses, and maybe most importantly, what it means for your long-term health and vitality.
Right.
We've gathered some pretty comprehensive sources to get to the very heart of what's happening, inside your veins.
It's remarkable, isn't it, how what seem like minor glitches in our body's circulatory system can, over time, cascade into genuinely significant health challenges.
Yeah, absolutely.
We're not just looking at the what of CVI, but crucially, the why, the underlying mechanisms. Understanding these can truly empower us, particularly as age becomes such a prominent factor in our health. It's about recognizing that these seemingly small issues can have really profound ripple effects.
Exactly. This deep dive is designed to arm you with insights, to help you recognize the subtle signs, grasp the true risks, and understand the concrete steps that can make a real difference. If you're over 50, or perhaps you care for someone who is, this conversation is especially for you. We'll frequently touch upon why age is such a significant piece of this complex puzzle, particularly here in the States. Okay, so let's start at the beginning. What exactly is chronic venous insufficiency?
Good place to start.
At its core, CVI is a condition where the veins in your legs are damaged. They just can no longer effectively return blood back up to your heart.
Right, the flow is impaired.
So instead of making that upward journey, blood starts to pool and pressure builds up in your leg veins.
Yeah, it just sort of sits there.
To visualize this, maybe imagine your healthy leg veins as this sophisticated network of one-way streets.
Okay.
Each street has tiny, really delicate one-way valves, like perfect little hinged doors designed to open and let blood flow upwards against gravity,
Mm-hmm. Fighting gravity.
and then snap shut to prevent it from flowing backward.
that snapshot is key.
But in CVI, these crucial valves malfunction. They're like doors that don't quite close all the way, or maybe they sag a little.
Leaky doors.
Exactly. The result is a phenomenon we call venous reflux. Blood flows backward and collects in your lower legs.
Right, reflux. That's the technical term for the backflow.
And this isn't just, a minor inconvenience. CVI is a progressive and, multifaceted vascular condition.
Progressive is a really important word there.
Yeah, it often begins subtly, maybe with just a feeling of heaviness or some minor swelling that kind of comes and goes.
You might not even notice it much at first.
But if left unaddressed, this traffic jam in your veins can lead to increasingly serious complications that really impact your daily life and overall well-being.
What's truly striking is how widespread this problem can be throughout your venous system. CVI isn't confined to just one type of vein.
Okay.
It can affect your deep veins, those larger vessels running deep within the muscle tissue, like the main highways for blood return.
Gotcha, the big ones.
It can also impact the superficial veins, which are closer to the skin's surface. These are the ones you often see as those telltale varicose veins.
Right, the bulging ones.
And critically, it can involve the perforating veins. Think of these as the connecting tunnels or maybe bypasses between your deep and superficial systems.
So connecting the highways and the surface roads.
Exactly. This broad potential for damage really underscores the complexity of CVI and why it can manifest in so many different ways.
That makes sense.
It's also really important to clarify the relationship between CVI and another term you might hear: post-thrombotic syndrome, or PTS.
PTS.
Okay, basically PTS is a specific form of CVI. It's one that is directly caused by a past deep vein thrombosis, a DVT.
So a blood clot triggers it.
Precisely. A DVT, as you probably know, is a blood clot that forms in a deep vein, typically in the leg.
Mm-hmm.
Now, even after that blood clot is gone, maybe your body dissolved it or treatment helped clear it, it can leave behind lasting scar tissue.
Like damage left behind.
Exactly like damage left behind. This scar tissue acts like, a wrecking ball, damaging those delicate one-way valves we just talked about.
Wow.
So while not all CVI is PTS, about 20% to maybe even 50% of individuals who have a DVT will go on to develop PTS within 1 or 2 years.
That's a surprisingly high number.
It is. It shows the lasting impact of even a seemingly resolved clot.
Definitely something to be aware of if you've had a DVT.
Absolutely. And when we look at the bigger picture of public health, venous disease in general is incredibly common.
How common?
Well, for instance, visibly twisted or bulging varicose veins affect about 1 in 3 adults.
1 in 3, wow.
Yeah. And more specifically, CVI itself affects roughly 1 in 20 adults.
1 in 20. Still quite a lot.
It is, and it's a condition that often progresses. About 1 in 50 adults who initially only have varicose veins will go on to develop CVI each year.
So varicose veins can be a stepping stone.
They can be a warning sign, absolutely. These numbers really highlight just how prevalent this condition is and why understanding it is so crucial. And for our listeners, especially those of you thinking about your health as you age, the role of age in CVI is a key insight. Our sources are very clear on this.
Okay.
CVI usually begins to affect people over the age of 50. And what's more, the risk of developing CVI significantly increases with each passing year.
So it really is an age-related issue for many.
Very much so. So for those of us in or approaching our golden years here in the U.S., understanding CVI isn't just, an interesting medical fact. It's a crucial component of proactive health management.
Right. It becomes more relevant.
It disproportionately impacts our older population, making awareness and early intervention even more vital for maintaining independence and quality of life.
And what happens if it's not treated? You mentioned complications.
Yeah, and without timely treatment, the implications of CVI move beyond simple discomfort to significant tissue damage.
Okay.
That sustained high pressure in your leg veins can cause the tiniest blood vessels, the capillaries, to eventually burst.
Oh, wow.
This leads to chronic tissue inflammation and further damage, which can ultimately result in venous stasis ulcers.
Ulcers, like open sores.
Exactly. Open sores, typically appearing on the skin's surface, often around the ankles, they're notoriously difficult to heal and are highly susceptible to infection.
Infection sounds serious.
It can be. It can potentially lead to a dangerous condition known as cellulitis if not treated promptly. So, recognizing these signs early and intervening effectively isn't just about managing symptoms, it's about preventing this whole cascade of increasingly serious health problems.
That's a powerful picture of how CVI progresses. So, if those valves are indeed the core of the problem, what exactly goes wrong with them?
Right, the million-dollar question.
We know the most significant cause is when these vital one-way valves in your leg veins become damaged and just can't do their job properly. But it's not just one single thing that causes them to malfunction, is it? The reasons fall into a few distinct categories, almost like different ways the one-way street system can break down.
That's a good way to put it. There are different pathways to the same problem.
Okay, so what's the first category? First, you might have congenital causes. This means you're basically born with the issue.
Right, from birth.
It could be malformations in your leg veins themselves. Maybe they didn't form quite right during development. Or in some pretty rare cases, a person might even be born without certain valves altogether.
So an anatomical predisposition, like a blueprint with a slight flaw from the start.
Exactly. Present from day one. Then there are primary causes. These are changes that occur within the leg veins themselves without an obvious external trigger.
Okay, changes from the inside out, sort of.
Yeah. Picture a vein that simply becomes too wide over time. When the diameter of the vein expands, the valve flaps inside, which are designed to meet perfectly. They can no longer close completely. Imagine a door frame that's suddenly too wide for the door. No matter how hard you try, it just can't latch shut.
So the structure itself changes, preventing the seal.
Right. This inherent change within the vein prevents the valve from forming that complete seal.
Makes sense.
And finally, and this is really important for many adults, particularly as we age, we have secondary causes.
Secondary causes, okay.
These are other medical issues or events that inflict damage on your leg veins. As we discussed, deep vein thrombosis, or DVT, comes back into the picture here as the most common secondary cause.
The blood clot connection again.
Exactly. A blood clot in a deep vein, even after it dissolves, leaves behind that scar tissue that directly damages the delicate valve structure, leading to long-term impairment.
That scarring is really persistent.
Our sources also point to other less common causes, like venous outflow obstruction, a physical blockage of blood flow, and arteriovenous malformation, which is an abnormal connection between arteries and veins. These too can contribute to developing CVI.
What's truly insightful here is that by understanding these different categories of causes, congenital, primary, secondary, we recognize that CVI isn't a single uniform disease.
Right, it's varied.
It's more like a spectrum of conditions that, regardless of their origin, ultimately lead to that same problematic outcome: blood pooling and high pressure in the leg veins.
And knowing the cause helps treatment.
Absolutely. This nuanced understanding is crucial because it helps doctors tailor more precise diagnostic approaches and more effective treatment strategies, especially when dealing with the complex health profiles that can come with aging. You treat the why as well as the what.
Okay.
Let's expand just a bit more on the lasting impact of scar tissue from DVT, because it's such a critical factor for so many people.
Okay.
When a blood clot forms, your body's natural response is to try and clear it. But even if that clot successfully resolves and blood flow resumes, the process often leaves behind a sort of ghost of the clot permanent scar tissue.
A ghost, interesting.
Yeah, it fundamentally compromises the valve's ability to function. It's not just a temporary blockage, it's lasting structural damage. It means the valve will never again fully prevent that backward flow of blood.
So the damage is permanent from the scar tissue.
Often, yes. It really emphasizes the long-term consequences of a DVT and why preventing it in the first place, or managing it effectively if it occurs, is so vital, particularly for older adults who might be more susceptible to clotting or have other underlying vascular issues already.
Right, prevention is key there.
So this brings up a really important question for many of us. If some causes are congenital or primary, meaning we're born with them or they develop without a clear external trigger, does that mean we're powerless against CVI?
Yeah, what can you do?
Well, absolutely not powerless. While you can't alter your genetic makeup or what you were born with, understanding a predisposition is key to early monitoring.
So being aware helps.
Tremendously. If you know you have a family history or you start noticing any early signs, you can be proactive. And for secondary causes like DVT, there are clear, actionable targets for prevention and intervention.
Ah, so we can influence those.
Definitely.
Yeah.
Knowing the cause helps us strategize, whether it's through vigilant monitoring, specific preventative measures, or prompt treatment if something like a DVT occurs. It puts some power back in your hands,
That distinction between causes is incredibly helpful. So once those valves are damaged, it truly sets off this whole chain reaction in your legs, doesn't it?
It really does. It's a cascade.
It's not just about blood flowing backward. It's about what that backward flow does to your entire circulatory system and the surrounding tissues.
Right, the consequences of the backflow.
The core engine driving this damage is what we call venous hypertension.
Hypertension, like high blood pressure, but in the veins.
Exactly.
Yeah.
Think of this as persistently elevated pressure in your leg veins.
Yeah.
It's directly due to that blood pooling and the impaired return to the heart.
Mhm.
This pressure is particularly worsened when you're standing upright or even just sitting with your legs down, as gravity constantly works against an already struggling venous system.
Gravity becomes the enemy, in a way.
Pretty much.
Hmm.
And this high pressure then circles back to valvular incompetence and reflux. But maybe we can look at it in more detail now.
Sure.
It's the fundamental inability of those one-way valves to close properly,
Yeah.
leading to that backward flow of blood, the reflux.
Right.
This reflux can happen in any of your vein systems, superficial, deep, or those critical connecting perforating veins.
It can affect any part of the network.
And the problem can stem from the valves themselves being inherently weakened, maybe stretched or abnormally shaped, or, as we discussed, from the vein diameters simply widening too much.
The wide door frame problem.
Exactly. Which physically prevents the valve leaflets from meeting to form a complete seal.
What's truly fascinating here, though, is that CVI isn't just a simple plumbing problem with faulty pipes and valves. It's deeply intertwined with your body's own defense system. It becomes a chronic inflammatory condition.
Inflammation. How does that happen?
Well, that persistent venous hypertension, that high pressure, acts like a constant alarm bell. It triggers a cascade of what we call inflammatory mediators. Think of them as tiny signaling molecules shouting that something's wrong.
Okay.
And alongside these, adhesion molecules emerge, like sticky Velcro patches appearing on the inside lining of your veins.
Velcro in your veins.
Sort of. These patches grab onto passing white blood cells, the body's immune cells, even when they shouldn't. This sustained, misguided inflammation then contributes to significant structural alterations, leading to long-term damage in the vessel walls.
So the body's response actually makes things worse.
In this chronic state, yes. The endothelial cells, which form that delicate inner lining of your blood vessels, aren't just passive, they're active participants in starting and propagating this inflammatory cycle.
Wow. Okay, so inflammation is a big player.
A huge player. And this chronic inflammation inevitably leads to vessel wall remodeling and damage.
Remodeling, like changing the structure.
Exactly. We see endothelial dysfunction, meaning the inner lining stops working correctly. There's increased white blood cell adhesion, those immune cells sticking to the walls, fueling more inflammation and damage. This starts a process of remodeling, where the very structure of the vein walls begins to change. You get a degenerative loss of important structural proteins like elastin.
It's elastin that gives it stretchiness.
Right, gives veins their natural elasticity and spring. And you lose collagen, which provides strength and structure.
Get weaker.
Weaker and stiffer. Over time, this loss leads to fibrosis, which is basically scarring within the vein walls.
Scarring inside the veins.
Yeah, causing them to thicken and stiffen. This directly contributes to the development of those bulging, less efficient varicose veins.
Ah, that connects to varicose veins.
It does. So instead of being flexible and resilient, your veins become stiff and scarred, like an old, hardened rubber hose. The critical insight here is that this structural breakdown isn't passive. It actively fuels more inflammation, creating a destructive feedback loop that makes the problem progressively worse.
A vicious cycle.
Precisely. Which is why addressing CVI early isn't just about comfort. It's about breaking that cycle of systemic damage.
Okay. What else is part of this cascade?
Then there's the issue of venous outflow obstruction. In some cases, the impaired emptying of blood from the veins is caused by a physical blockage in the deep veins.
Like something blocking the pipe.
Exactly. As we discussed, this is frequently a consequence of a DVT. If a thrombus or blood clot doesn't completely clear or recanalize, meaning the body doesn't fully dissolve it or carve a new channel through it, then the vessel lumen, the inner channel of the vein, remains narrow or even completely blocked. This, of course, physically obstructs the outflow of blood back towards the heart.
A literal roadblock.
Yes. And beyond DVT, there can also be extrinsic vein compression. A classic, though often overlooked example is May-Thurner syndrome.
May-Thurner.
Yeah, where the left common iliac vein, deep in the pelvis, is physically squeezed and compressed by the right common iliac artery crossing over it.
So one vessel squashes another.
Essentially, yes. Other masses within the abdomen can also cause similar compression. These structural roadblocks impede healthy blood flow, leading to both outflow obstruction and reflux.
Interesting. Seems like a lot is going wrong.
It is a complex interplay, and this all prompts an important question. How does our body normally fight gravity, particularly in our legs, which are so far from the heart?
Right, how does blood get back up?
Well, our calf muscles act as a truly remarkable second heart.
A second heart.
Functionally, yes. When you walk, these muscles contract and relax, rhythmically squeezing the deep veins in your legs. This muscular action is incredibly efficient at pumping blood back up to the heart.
So walking is like pumping blood.
Exactly. In CVI, the efficiency of this vital calf muscle pump can be severely impaired, further contributing to venous hypertension and that troublesome blood pooling.
So if the pump is weak, the problem gets worse.
Definitely. What's more, even conditions that seem unrelated, like arthritis that limits ankle flexion and therefore restricts the full range of motion of your calf muscles, that can significantly weaken this crucial pump. Imagine a pump operating at half power, it just can't keep up.
So joint problems can affect veins too.
Indirectly, yes. For older adults, declining mobility or joint issues can directly impact the second heart, making them more susceptible to CVI or worsening an existing condition.
Wow, it's all connected.
Very much so. And the damage extends even to the smallest vessels, the intricate network known as the microcirculation.
The tiny ones.
The tiniest. Sustained venous hypertension profoundly impacts this delicate network. The smallest veins and venules within the system can also develop incompetent valves, similar to the larger ones.
So the problem goes all the way down.
All the way down. Capillaries, the tiniest blood vessels where all the critical oxygen and nutrient exchange actually happens, become elongated, dilated, and tortuous. They stretch out, widen, and twist into these convoluted paths.
That sounds bad for nutrient exchange.
It is. This results in endothelial dysfunction at this micro level, causing fluid to leak out of these vessels into the surrounding tissues, leading to that characteristic edema or swelling.
That's where the swelling comes from.
Largely, yes.
No.
You also get something called fibrin cuff formation, where proteins build up around the capillaries, creating a barrier that further impedes nutrient exchange. All of this contributes to a chronic inflammatory reaction even in these smallest vessels, further exacerbating the cycle of damage.
So after all this intricate internal damage, what does it all mean for what you can actually see on the surface of your skin?
Right, the visible signs. Over time, these microcirculatory changes lead to the leakage of red blood cells, a process called extravasation out of the damaged capillaries and into the surrounding tissue.
Red blood cells leaking out.
Yes. When these red blood cells break down, they leave behind iron deposits, which we call hemosiderin. This is what causes that permanent, telltale reddish-brown skin discoloration you often see. It's a visible marker of long-standing damage.
That brown staining on the lower legs.
Exactly. As the disease progresses further, you can also observe lipodermatosclerosis.
Lipodermatosclerosis. That's a mouthful.
It is. It's a distinctive skin thickening due to fibrosis or scarring in the subcutaneous fat, the fat layer just beneath the skin. It makes the skin feel hard and kind of woody.
Hard and woody skin.
Yeah. And eventually, this severe tissue damage and chronic inflammation can lead to ulcer formation. These skin changes are not just cosmetic. They are critical, visible indicators of advanced CVI. They signify significant underlying pathology and are often what finally prompts people, especially older adults, to seek medical attention because they're concerning and can impact mobility and raise infection risk.
That detailed look at the mechanisms truly helps connect the dots from what's happening inside to what we see and feel outside. So let's talk directly about the symptoms. What does CVI actually feel like and what does it look like?
All right, let's get practical.
You might first notice general aches and pains in your legs. This could manifest as just generally tired or heavy legs, maybe a persistent burning sensation,
That deep ache sometimes.
tingling, or even that distinct feeling of pins and needles. Night cramps too. Those uncomfortable muscle spasms that can just wake you right up.
Oh yes, night cramps are very common. They can really disrupt sleep quality, which has its own set of knock-on effects, especially as we age.
Definitely. Another prominent sign is swelling and heaviness. You'll likely experience edema, that medical term for swelling, typically in your lower legs and ankles.
Right, the fluid buildup.
This is often most noticeable after you've been standing or sitting for a while, or certainly by the end of the day, as gravity has had more time to exert its influence.
Gravity wins again.
Yeah. Your legs might just feel uncomfortably full or persistently heavy, like they're dragging you down with every step.
That heavy leg feeling is very characteristic.
Then there are distinct skin clues that can appear on your legs and feet, acting as visual alarms.
Things you can see.
Look out for discolored skin that takes on that reddish-brown appearance we just heard about from the iron deposits.
The hemosiderin staining?
You might also notice flaking or persistently itching skin, or even skin that begins to look leathery and thickened in texture.
Those texture changes are important clues.
These are key visual indicators that something is amiss beneath the surface, signaling long-term vascular stress. And the most serious visible sign is the development of ulcers.
The open sores.
Exactly. Open sores, usually forming near your ankles. If these ulcers are particularly painful, that's a strong sign they could be infected and require immediate medical attention.
Pain is a red flag for infection, definitely.
And of course, varicose veins are a very common symptom, appearing as visibly twisted, bulging veins close to the surface of your skin.
Can't miss those sometimes.
It's crucial to understand, though, that you may not experience all of these symptoms at once, right? And they can certainly worsen as the condition progresses.
Absolutely. It's a spectrum.
What might start as mild intermittent swelling could, over time, lead to severe constant edema in your lower leg. This severe swelling can cause scar tissue to develop, trapping fluid in your tissues and making your calf feel large and hard to the touch.
That hardening is the lipodermatosclerosis we mentioned.
Right. When this happens, your skin becomes much more vulnerable to persistent ulcers that are notoriously difficult to heal, especially for older skin, which might already be more fragile.
That progression really highlights why early assessment is so vital. Which brings up an important question. How do doctors actually categorize the severity of these symptoms and signs?
Is there a system?
There is. Venous disorders are staged using a widely accepted system called the CEAP classification. CEAP. It ranges from 0 to 6.
CEAP 0 to 6.
Okay. This staging is based on the clinical signs that a healthcare provider can visibly see or feel, the etiology or cause, the anatomical location of the problem, and the underlying pathophysiology, the functional problem. But mostly, we talk about the C part, the clinical stages 0-6.
Based on what they see or feel.
Exactly. It provides a standardized way to communicate the extent of the disease.
Can you walk us through those stages?
Sure. Let's break down these stages so you can better understand where you might fit or what to look for. Stage 0. At this initial stage, there are no visible or palpable signs of venous disease. No swelling, no varicose veins, nothing you can see or touch.
But you might still feel something.
Yes. You might still be experiencing symptoms like those achy or tired legs, a feeling of heaviness, or nighttime cramps. It's a kind of silent beginning symptom-wise for some.
Okay, stage 1.
Stage 1. Here, you start to see visible blood vessels, often including those small web-like capillaries known as spider veins, or maybe slightly larger blue veins called reticular veins.
So visible but small veins.
Right. Then, stage 2. This stage is characterized by the presence of varicose veins that are at least 3 millimeters wide. These are the larger, more prominent, bulging veins that many people recognize.
Classic varicose veins.
Exactly. Next, stage 3. This is where we consistently see edema or swelling in the legs, but crucially, there are no noticeable changes to the skin's color or texture yet. The swelling is the primary physical sign.
Swelling is the key for stage 3.
Stage 4. By this stage, there are clear, visible changes to your skin's color and/or texture.
The skin damage starts here.
Yes. This can include hyperpigmentation, that reddish-brown discoloration, or lepidermatosclerosis, the thickening and hardening of the skin we talked about. Stage 4 is sometimes subdivided into 4A, pigmentation or eczema, and 4B, lipodermatosclerosis or white atrophy.
Got it. What's after 4?
Stage 5. This stage indicates a healed ulcer, meaning you've had an open sore in the past, but it has now closed and the skin has repaired itself, leaving a scar.
So, evidence of a past ulcer.
Right. And finally, stage 6. This is the most advanced stage, characterized by an acute or actively present ulcer, an open sore that is currently there and often requires intensive wound care.
Active ulcer, that's the highest stage.
Yes. Now, what's truly a critical insight here for listeners is that you're typically diagnosed with chronic venous insufficiency if your condition is at stage 3 or above.
Stage 3 or higher means CVI diagnosis generally.
Generally, yes. So simply having varicose veins, which would put you at stage 2, doesn't automatically mean you have CVI.
That's important.
It is. However, varicose veins are a significant warning sign that you have underlying blood flow problems that could indeed worsen over time and progress to CVI. It's incredibly important to monitor them, especially as you age, and to discuss any new or worsening varicose veins with your healthcare provider. Early awareness can literally change the trajectory of the disease.
So stage 2 is a flag, stage 3 plus is generally CVI.
That's a good summary. And just to reiterate the serious implications, those burst capillaries we discussed earlier resulting from the sustained venous hypertension, they're key. They lead to chronic tissue inflammation and damage, which are the direct precursors to forming those stubborn venous stasis ulcers. Without appropriate and timely treatment, these ulcers don't heal easily and they are prone to becoming infected. An untreated infection can spread to nearby tissues, leading to cellulitis.
That dangerous infection again.
Exactly. A potentially dangerous bacterial infection that requires immediate medical attention and can be particularly severe in older adults, maybe those with compromised immune systems or other chronic conditions like diabetes. This progression really highlights why vigilance and professional care are so critical.
That staging system gives us a really clear roadmap of the disease. Now, let's pivot to understanding who is most likely to develop CVI.
Right, the risk factors.
We know some factors are beyond our control, like our family history, but many others seem very much within our daily choices and lifestyle.
That's true, there's a mix.
For our listeners, especially those in the U.S., focused on maintaining health as they age, advanced age is undeniably a major risk factor, right?
Absolutely central. CVI typically begins to affect people over age 50, and the risk significantly increases with each passing year.
So time itself is working against the veins, in a way.
You could say that. The cumulative effects of daily life, gravitational pull, maybe minor injuries, other health conditions, they all add up and can make veins more susceptible over time.
Okay, what about gender? Biological sex also plays a role, with women generally being more prone to CVI than men.
Hormones are thought to be a big part of that.
And weight matters significantly, doesn't it?
Yeah.
Obesity or just carrying excess weight puts additional constant pressure on your veins
Extra load.
and can directly damage those vital valves, making it harder for blood to flow back to the heart. This added strain compounds over years.
Yeah, weight management is a really key factor here.
Pregnancy's impact is also considerable, and for many women, it's a key trigger or worsening factor for vein issues.
Definitely. Several factors contribute during pregnancy. Hormonal changes, particularly increased progesterone, which can relax vein walls, making them stretchier.
Okay.
A significant increase in blood volume circulating throughout the body, putting more demand on the veins.
More fluid to move.
Exactly. And the physical pressure from the growing uterus on pelvic veins, which can obstruct flow from the legs. All contribute to increased CVI risk during and sometimes after pregnancy.
So pregnancy is a big stressor on the leg veins.
It certainly can be. Your occupation and lifestyle can also be significant players.
Like jobs where you stand all day.
Exactly. If your job or daily routine involves prolonged standing or sitting, this contributes directly to venous hypertension and the progression of venous disease.
Because gravity's constantly pulling down.
Right. Without the aid of your powerful calf muscle pump working regularly, that blood just pools. Genetics and family history are also often involved.
Runs in the family.
It often does. If you have a family history of varicose veins or other venous pathology, your own risk of developing CVI is considerably higher, indicating a clear hereditary component.
Something you inherit.
Now, perhaps the most important individual risk factor to highlight is a history of deep vein thrombosis, DVT, or thrombophlebitis, which is inflammation of a vein, often with a clot.
The DVT connection again.
Yes. As we discussed, a DVT is the most common cause of that secondary CVI because the blood clot leaves behind damaging scar tissue that compromises valve function. So if you've had a DVT in the past, your risk for CVI is significantly elevated. Vigilance becomes even more critical.
Makes sense.
Lastly, while varicose veins are a symptom of underlying venous issues, they are also considered a significant risk factor for developing more severe CVI down the line if left unaddressed.
So they're both a sign and a risk.
Correct. They're a visible indicator that your venous system is already under strain and might progress further.
Okay, those are the big ones. Anything else?
What's fascinating here is that sometimes very specific anatomical issues are at play that aren't immediately obvious, such as May-Thurner syndrome.
We mentioned that briefly, where one vessel squeezes another.
Exactly. That condition where the left common iliac vein deep in the pelvis is physically compressed by the right common iliac artery. This consistent squeezing can lead to outflow obstruction and significantly increase the risk for CVI, particularly on the left side. It just highlights how complex the venous system can be.
Definitely not always straightforward.
And this leads us to a crucial question. Why do things like smoking or prolonged immobility contribute so significantly to CVI?
Yeah, the lifestyle factors.
Well, smoking and tobacco use are unequivocally detrimental to general vein health. They damage the integrity of your blood vessels across the board, making them stiffer, more prone to inflammation, less efficient.
Just bad for circulation overall.
Absolutely. As for sitting or standing for long periods, it directly increases venous hypertension because your leg veins are constantly battling gravity without the aid of your calf muscle pump. If you're standing still, that blood is just sitting there, putting pressure on the valves.
Yeah.
Even something as seemingly innocuous as regularly sleeping in a chair or recliner, which keeps your legs in a dependent position for extended periods, can be a factor over time, exacerbating the pressure within your veins.
Huh. Even sleeping posture matters.
It can contribute, yes. These seemingly minor habits have a cumulative effect.
What about less obvious risks?
We also have some less obvious but still important risk factors. A history of a significant leg injury or trauma can sometimes predispose you to CVI, as direct damage to veins or surrounding tissues can compromise function.
Makes sense.
Oral contraceptive use is also often listed as a risk factor, likely due to the hormonal influences they have on vein wall health and potentially clotting factor.
Hormones again.
Yes. And as we touched upon earlier, conditions like arthritis, particularly if it significantly limits ankle flexion and movement, can weaken that crucial calf muscle pump.
Right, the second art.
If you can't fully flex your ankle, your calf muscles can't efficiently squeeze those deep veins to push blood back to the heart, contributing to venous hypertension.
So many connections.
When we connect all these threads to the bigger picture, it becomes clear that CVI isn't just one isolated event. It's often a culmination of genetic predispositions, various life events like pregnancy or DVT, and lifestyle choices that compound over time. This makes older individuals, particularly those here in the US, who may have accumulated a number of these risk factors throughout their lives, especially vulnerable to developing or progressing CVI. It really underscores the profound importance of taking a holistic view when assessing and managing risk, making personalized care all the more essential as we age.
That comprehensive look at risk factors really makes you pause and, consider your own situation. So, if you suspect CVI, what actually happens next? How is it diagnosed? And once diagnosed, what does treatment truly look like?
Right, the action plan.
Diagnosis typically begins with a thorough physical exam. Your healthcare provider will carefully examine your legs for those clinical signs we've discussed: any ulcers, skin discoloration, hardness, swelling, visible varicose veins.
Looking for the clues.
But the definitive test is usually a painless vascular ultrasound, also called a duplex ultrasound.
That's the gold standard.
It uses high-frequency sound waves to create a detailed image of your veins in real time. It shows the structure of the veins and the direction of blood flow.
So you can actually see the reflux, the backward flow.
Exactly. It allows the provider to pinpoint exactly where valves are damaged or where blood flow is struggling and refluxing. It's non-invasive and gives a very clear picture of what's happening internally.
Very effective diagnostic tool.
Your provider will also take crucial steps to rule out other medical conditions that could be causing your symptoms. Because, leg swelling or pain can come from other things too.
Like heart failure, kidney problems, lymphedema.
Right. So this might involve additional blood tests or maybe other imaging, possibly including an MRI in some cases, just to get a complete diagnostic picture.
Important to rule out other causes.
Now, here's an important connection that often surprises people. Many individuals who have CVI also have peripheral artery disease, or PI.
Ah, yes, PA. Problems with the arteries bringing blood down to the legs, not just the veins bringing it back up.
Exactly. Your provider will certainly check for this, often with a simple test called an ankle brachial index, or ABI, because having both conditions significantly affects how certain treatments, particularly compression therapy, can be used. It's crucial to address both conditions simultaneously and carefully.
You can't just squeeze the leg hard with compression if the arteries aren't delivering enough blood in the first place. It could be dangerous.
Good point. So that PA check is vital.
Absolutely. It demonstrates the importance of a comprehensive vascular assessment.
Okay, so diagnosis is clear. What about treatment? The truly encouraging news is that there are many effective ways to manage CVI, offering significant relief and improvement.
Lots of options, which is good news.
The goals of treatment are clear and focused. Improve blood flow in your veins, help any existing ulcers heal and prevent them from returning, improve the appearance and health of your skin, and perhaps most importantly, significantly reduce pain and swelling, ultimately improving your overall quality of life.
It's about managing symptoms and preventing progression, not just living with it, but actively managing it.
Exactly. Proactive management.
That's absolutely right. And what's particularly empowering is that often the first and most impactful interventions for CVI aren't complex medical procedures, but fundamental lifestyle changes. These are truly foundational.
Things you can do yourself.
Yes, foundational for managing the condition and critical for all age groups, including older adults, as they can be integrated quite easily into daily routines and make a substantial difference.
So what are these lifestyle changes?
First and foremost is consistent leg elevation. Simply lifting your legs above the level of your heart can significantly help reduce that built-up pressure in your leg veins.
Putting your feet up, literally.
Literally. Your provider might suggest doing this for 30 minutes or longer, maybe 3 or 4 times per day. It's a simple, effective way to help gravity work with your veins for a change.
Makes sense. What else?
Then there's exercise. Regular physical activity, especially walking, is incredibly beneficial.
Activating that second heart.
Exactly. Each time you take a step, your calf muscles contract and relax, acting like that powerful second heart, efficiently pumping blood back up to your actual heart. Strengthening these calf muscles directly improves circulation.
So walking is medicine here.
It really is. Your provider may also recommend specific foot and ankle flexing exercises you can do even while sitting, like pointing your toes up and down or making circles with your ankles to boost this calf muscle pump throughout the day.
Good tips for people who sit a lot.
Definitely. And finally, weight management is crucial. Carrying excess weight puts additional unnecessary pressure on your veins and can damage those delicate valves. So working with your provider to achieve and maintain a healthy weight is a powerful long-term intervention that eases the burden on your venous system.
Elevation, exercise, weight management, the foundation.
The foundation. Now, to support those damaged veins and actively reduce swelling, compression therapy is a cornerstone treatment for CVI.
The tight stockings.
Often, yes, the stockings. Compression therapy works by providing external pressure to your legs. This eases swelling and discomfort, and importantly, helps your veins work more efficiently by gently squeezing them to encourage blood flow upwards.
How does it help the veins?
It provides external support, narrows the dilated veins so the dowels might work a bit better, and increases the pressure in the tissues to reduce leakage and swelling.
Okay. Are there different types?
Many types, from simple elastic bandages to various graduated compression stockings. Graduated stockings, which are tighter at the ankle and gradually less tight as they go up the leg, are highly effective because they mimic the natural pressure gradient needed for blood return.
Graduated pressure is key.
It is. However, it's absolutely essential to get guidance from your provider on the specific type, strength measured in millimeters of mercury or mmHg, and fit of compression you need.
All right, not just any tight sock.
Definitely not, especially if you have coexisting conditions like PA, where certain compression levels might be contraindicated or even harmful.
Need a prescription strength, basically.
Often, yes. And one common challenge, particularly for older adults, is adherence. Consistently wearing these stockings can be difficult.
Why is that?
They can be uncomfortable, hot, hard to put on, especially with arthritis or limited mobility, or cause skin irritation.
So people just don't wear them.
It can be a real struggle. If you find yourself struggling, talk to your provider. There might be a different material, a lower compression level that still helps, or tools like stocking donners to make getting them on easier. Communication is key.
Good advice. Are there alternatives to stockings?
For some individuals, yes. If stockings aren't enough or aren't tolerated, intermittent pneumatic compression (IPC) devices can be used. These are inflatable sleeves that wrap around the legs and connect to a pump that periodically inflates and deflates them, squeezing the legs to promote circulation. Often used at home for set periods.
Like automated massage boots?
Kind of, yeah. They actively pump the blood.
Okay. What about medications?
Moving on to medications, these are typically prescribed to address symptoms or complications rather than directly fixing the underlying valve damage.
So managing the consequences.
Right. Antibiotics are crucial for clearing any skin infections or ulcers that arise from CVI, preventing them from worsening or spreading.
For infections.
Anticoagulants, often called blood thinners like warfarin, heparin, or newer agents, are prescribed to treat existing blood clots and, crucially, to prevent new ones from forming, especially for those with a history of DVT or ongoing risk.
Preventing clots.
Yes. Additionally, for wound care, particularly for ulcers, medicated wraps like the Boot are very helpful. It's a multi-layer compression wrap that includes a zinc oxide gel-based gauze layer. It forms a semi-rigid bandage that provides compression and a moist healing environment for venous ulcers.
A special bandage for ulcers.
Very effective for many people.
So, if lifestyle, compression, and meds aren't enough,
then we consider non-surgical treatments that directly target the problematic veins themselves.
interventions.
Right. Sclerotherapy is one common option, especially for spider veins or smaller varicose veins. It involves injecting a special foam or liquid solution directly into the vein.
What does this solution do?
It irritates the lining of the vein, causing it to scar and collapse. The body then naturally reabsorbs the collapsed vein over time, and blood is rerouted through nearby healthy pathways.
So it closes off the bad vein.
Essentially, yes. Another very effective option, often for larger varicose veins like the great saphenous vein, is endovenous thermal ablation.
Thermal means heat.
Yes. This technique uses either laser energy or high-frequency radio waves delivered through a thin catheter inserted into the vein. This generates intense heat right inside the diseased vein.
And the heat does what?
It effectively damages the vein wall, causing it to close up, seal shut, and eventually fade away. It's minimally invasive, often done in an office setting with less bleeding or bruising compared to traditional surgery.
Sounds quite advanced.
It is, and very common now.
What if even those don't work or aren't suitable? Are there surgeries?
Yes, for more advanced or resistant cases, surgical treatments are available, though they're used less often now with the success of endovenous techniques.
Okay, like what?
Traditional ligation and stripping used to be the mainstay. Ligation involves surgically cutting and tying off problematic veins, usually the main superficial vein at the groin. And stripping is the physical removal of longer segments of diseased veins through small incisions.
More invasive.
Yes, definitely more invasive, requires anesthesia, longer recovery. Then there's microincision or ambulatory phlebectomy. This is a minimally invasive procedure specifically for removing bulging superficial varicose veins.
How does that work?
Through tiny incisions or needle punctures, the provider uses a special hook to physically pull out segments of the varicose veins. It's often done with local anesthetic and has a quicker recovery than stripping.
Removing them directly through tiny holes.
Pretty much. There's also subfacial endoscopic perforator surgery, SEPS. This is another minimally invasive technique that specifically targets those connecting perforator veins, often above the ankle, which are frequently involved in causing recurrent ulcers.
Targeting the connectors.
Exactly. Using an endoscope, a small camera, the surgeon can precisely locate and clip off these damaged perforating veins through small incisions away from the ulcerated area. This helps heal existing ulcers and prevent them from coming back.
That sounds very targeted for ulcer prevention.
It can be very effective for that specific problem. And finally, for very severe cases where maybe the deep veins are blocked or severely damaged and no other treatment has been effective, there's vein bypass surgery.
Like heart bypass.
Similar in principle, yes. It's a major procedure where a surgeon takes a healthy vein from another part of your body, or sometimes a synthetic graft, and uses it to reroute blood flow around a severely damaged or blocked segment of vein, usually in the thigh or pelvis.
A major rerouting job.
A major rerouting job, reserved for complex cases. This full spectrum of strategies really underscores that the best treatment is always personalized. It has to be tailored to the individual's specific condition progression, the CEP stage, their symptoms, their lifestyle, and importantly, any other medical conditions they may have a particularly vital consideration for older adults who often have complex health profiles.
That's an impressive array of treatment options, really offering hope for managing CVI. So what does this all mean for your future if you have CVI? What can you realistically expect? And how can we proactively work to prevent it, especially as we get older?
Right, the long-term view and prevention.
The general outlook is that CVI is usually not life-threatening, correct?
Hmm.
And it doesn't typically lead to amputation like severe arterial disease sometimes can.
That's generally true, yes. It's more about quality of life than immediate life threat for most people.
However, it is a progressive disease. This means that if left unmanaged, those symptoms can worsen, causing significant discomfort, pain, and genuinely reducing your quality of life, making it hard to walk, work, or enjoy activities.
It can become quite disabling if severe and untreated.
But the very good news is, treatment can effectively manage your symptoms and lead to a much better quality of life. It's about active management, not passive acceptance.
Absolutely. Symptom control and preventing complications are very achievable goals.
Now here's an important point, and maybe a challenging one. Venous ulcers. You mentioned they're hard to heal. Are they prone to coming back?
Unfortunately, yes. Venous ulcers are notoriously difficult to treat, often requiring months of dedicated wound care and compression. And even after they heal, they have a high tendency to recur, sometimes in the same spot, sometimes nearby.
Why do they come back so often?
Because the underlying problem, the venous hypertension and damaged skin, often persists even after the ulcer closes. Unless that's effectively managed long-term, the skin remains vulnerable.
So healing the ulcer isn't the end of the story.
Not at all. This really highlights why keeping all your medical appointments and diligently following your healthcare provider's guidance on things like lifelong compression therapy is so critically important. It's not a one-and-done situation. It truly requires ongoing vigilance and consistent self-care to prevent recurrence.
Constant management is key for ulcer prevention. So can CVI be reversed or even cured? We touched on this, but let's clarify.
Yeah, it's a common question. Unfortunately, current treatments cannot reverse the underlying physical damage to your vein valves that has already occurred. That structural damage is generally permanent.
So the valves don't magically fix themselves?
No. In that sense, the condition itself cannot be cured. However, and this is a crucial distinction, treatment absolutely can manage or even reverse your symptoms, making you feel much better and significantly improving your quality of life.
Managing symptoms, not curing the root cause.
Exactly. And procedures like ablation or sclerotherapy can effectively target and eliminate the damaged veins so that blood no longer flows through them incorrectly. Blood is rerouted through healthy pathways. So while we don't fix the broken valve, we manage its impact and ensure efficient circulation through other routes.
Okay, that's a hopeful way to look at it.
Yeah.
Beyond treatment, what concrete steps can you take to lower your risk of developing CVI in the first place, or prevent it from getting worse, especially as you navigate the years past 50?
Prevention is huge. Several strategies are key, and many overlap with just general healthy living, which is great.
Like what?
First, avoid smoking and any tobacco use. It's just essential for overall vein health and blood vessel integrity. Don't smoke. If you do, quitting is one of the best things you can do.
Number 1.
Next, mind your clothing. Avoid restrictive items like tight girdles, belts, or even socks or knee highs with tight bands that dig in and create a constricting effect around your legs or waist. These can impede healthy blood flow upwards.
Let the blood flow freely.
Right. Stay active by avoiding long periods of sitting or standing still. If your job or lifestyle requires it, set a timer, get up, move around frequently, do those ankle pumps.
Keep moving.
Adopt a heart-healthy diet. This generally means balanced nutrition, but specifically for CVI, reducing your sodium intake can help manage fluid retention and swelling.
Less salt.
Exercise regularly. We keep coming back to this, but it's crucial for maintaining the powerful function of your calf muscle pump. Walking is fantastic.
Use that second heart.
Use it. Maintain a healthy weight for your body to reduce excess pressure on your veins. Even modest weight loss can make a difference if you're overweight.
Weight management again.
Yes. And if you have a history of DVT, your provider might recommend long-term anticoagulants or other strategies to prevent future blood clots, which is critical since DVT is such a major risk factor for CVI.
Preventing the trigger.
Exactly. These lifestyle modifications are particularly impactful for older adults, providing a clear pathway for proactive health management and maintaining leg health.
Those are great prevention tips.
They really are, and they lead to an important question. How can you actively manage CVI at home and integrate these strategies into your daily life? Because consistency is key.
Right, making it part of your routine.
While your provider is always your best guide for personalized advice, some general self-care tips are broadly applicable and can make a huge difference, particularly as routines settle in later life.
Okay, daily self-care tips.
Movement is key. We just said it for prevention, but it's vital for management too. Avoid long periods of standing or sitting. If you're on long car or plane journeys, make a conscious effort to flex and extend your legs, feet, and ankles maybe 10 times every 30 minutes to keep blood flowing. If you have to stand, take frequent micro breaks to sit and elevate your feet if possible, or just shift your weight and walk in place.
Little movements add up.
They really do. Secondly, skin surveillance is vital, especially given the risk of ulcers and infections. Make it a habit to check your skin daily, maybe when you shower and get dressed. Look carefully at your feet, ankles, and lower legs for any changes, redness, new discoloration, blisters, scratches, new ulcers, or any signs of trouble. Call your provider immediately if you notice anything concerning.
Daily skin checks. Important.
Crucial. Consistent leg elevation above heart level when you're sitting or lying down should become a regular practice. Aim for 30 minutes several times a day if you can. Use pillows under your legs in bed or prop your feet up when watching TV.
Make gravity your friend sometimes.
Exactly. Consistent exercise, especially walking, is one of the best things you can do. It actively boosts your second heart, the calf muscle pump. Find an activity you enjoy and can stick with.
Keep walking.
Of course, weight management remains crucial. Maintaining a healthy weight reduces the ongoing strain on your venous system. Good skin hygiene is also critical, particularly for older adults where skin can be more fragile or dry. Wash your legs and feet gently daily, pat them dry carefully, especially between the toes, and moisturize your skin daily using creams recommended by your provider. This helps prevent flaking, dryness, and cracks that could become entry points for infection.
Keep skin healthy and intact.
Yes. Your provider can also advise on specific creams for itching, protection, or even fungal prevention if needed. And critically, wear your compression stockings or garments as prescribed every day, usually putting them on first thing in the morning before swelling starts.
The adherence piece again.
Yes, and ensure they fit correctly. No bunching, especially behind the knee, no rolling down. Ill-fitting stockings can actually worsen the condition by creating points of obstruction, like a tourniquet. If they don't feel right, or if they're getting old and losing elasticity, they likely aren't working right and need to be checked or replaced.
Get help with the fit if needed.
Absolutely. Pharmacists or medical supply fitters can often help.
Okay, so when should someone definitely see their healthcare provider?
When we connect all this to the bigger picture, Proactive engagement with your healthcare provider is paramount for anyone with CVI or even just at risk, especially as you age.
Be proactive.
See a provider if you have any CVI risk factors we discussed, even if you don't have symptoms yet. They can assess your situation and help you lower those risks before they become problems.
Get a baseline check if you're at risk.
Good idea. If you already have CVI, keep all your medical appointments and diligently follow their follow-up guidance. CVI needs ongoing management.
Don't skip checkups.
Right. Don't hesitate to call your provider if you have any questions. Notice new or changing symptoms like worsening swelling, new pain, skin changes, or signs of an ulcer. Or if your compression stockings aren't fitting right, remember that no bunching rule.
Call if anything changes or doesn't feel right.
Exactly. And crucially, this is a life-saving point. Call 911 or your local emergency services immediately if you experience symptoms of a pulmonary embolism.
The clot traveling to the lungs.
Yes, a potential complication of DVT, which is linked to CVI. Symptoms needing immediate emergency care include sudden shortness of breath, sharp chest pain, especially when breathing deeply, rapid heart rate, unexplained cough, sometimes with bloody mucus, dizziness or fainting. Don't wait on those.
Okay, that's critical emergency advice.
Very critical.
We've covered a lot of information today, and it can certainly feel overwhelming. Are there some key questions listeners should feel empowered to ask their provider?
Absolutely. Being prepared with questions makes your visit more productive. Consider asking things like, based on my exam and ultrasound, what stage of CVI am I at?
Know your stage.
How can I best manage CVI at home, considering my current lifestyle and other health conditions?
Personalized home care.
I'm finding it hard to wear my compression stockings consistently. How can you help me stick with compression therapy? Are there alternatives?
Addressing the adherence challenge.
Do you think I need a procedure or surgery at this point? What are my options and what are the pros and cons?
Understanding treatment options.
And critically, what specifically can I do to prevent my CVI from getting worse?
Focusing on prevention. Asking these questions really makes you an active, informed participant in your own care journey. #outro. Okay, that was an incredibly comprehensive and insightful deep dive into chronic venous insufficiency. We've truly unpacked how it's far more than just, tired legs at the end of the day.
Much more complex.
It's a progressive condition where your body's amazing one-way street system for blood flow eventually breaks down, a challenge that becomes increasingly common and really important to manage as we get older here in the US.
The aging connection is undeniable.
We've explored everything from the intricate mechanisms, those tiny damaged valves, and the whole chain reaction of inflammation and pressure they cause,
The pathophysiology.
to the clear, visible symptoms like swelling and skin changes, and the wide spectrum of powerful treatments available from those foundational lifestyle changes like elevation and exercise, to targeted compression therapy, medications, and even advanced non-surgical and surgical interventions.
A lot of tools in the toolbox.
The key takeaway here, it seems, is absolutely knowledge and proactive management. While the underlying valve damage can't be reversed, and the condition itself can't be cured in the traditional sense,
Right.
your symptoms can be effectively managed, and your quality of life can be significantly improved with the right, consistent approach. It's about working with your body and your medical team to mitigate the impact of this progressive condition.
That's the message, really. Management and quality of life. When we connect all these pieces to the bigger picture, CVI serves as a powerful reminder of the constant silent battle our bodies fight against gravity every single day.
Never thought of it that way.
It highlights the unsung heroes that are our veins, and especially our calf muscles, our very own second heart.
That second heart idea is great.
It really is. And this raises an important question for you, the listener. How well are you supporting your own second heart in its vital work? Are your daily habits truly helping or perhaps inadvertently hindering its crucial function?
A moment for reflection there.
Managing CVI, or indeed preventing it, is truly a journey, not a destination. But with the understanding we've gained today, you can feel empowered to make informed choices for healthier legs and a better quality of life as you age, helping you live more fully and actively.
Well said. Take a moment right now to consider what stands out most to you from this deep dive. What's one change you might consider making, or one question you'll definitely ask your healthcare provider at your next visit? Your leg health is an absolutely critical component of your overall well-being, especially through the years, and it's certainly worth your focused attention.